Welcome to Healthcare Intelligence. I'm your host, Matt Meyer, and this podcast is brought to you by Telligen, where every day we strive to help people live their healthiest lives. On today's episode, we are discussing the subject matter of our most recent healthcare intelligence piece on Telligen.com titled The Shift from Transactional to Transformational Healthcare. For too long, healthcare management has operated in silos, processing authorizations here, conducting assessments there, with little connection between them. But what if the data collected for a simple prior authorization could also provide vital insights into maternal health outcomes? What if information requests that once took hours could be matched in real time? At Telligen, we are reimagining the entire approach, moving from reactive, transactional service to proactive, data-informed strategies that leverage technology and analytics, not just to work faster, but to work smarter and create lasting impact for members, providers, and communities. And I'm excited to dig into it with today's guest, Neal Cohen. Neal is the Vice President of State Health Solutions at Telligen, where he currently oversees the operations of the programs Telligen has with state governments nationwide. Born in South Florida, Neal attended the University of Michigan for his undergraduate degree before earning separate master's degrees from Nova University and the University of Miami. With 35 years in healthcare, he began his career as a licensed mental health professional and has spent 25 years in managed care, developing extensive expertise in clinical operations, utilization management, provider networks, and quality. Since joining Telligen in 2021, Neal has brought his deep industry knowledge to support state health initiatives. He currently resides in New Orleans with his wife and their dog, Sophie. All right, well, welcome to the podcast, Neal. Great to have you.
Good to be here.
Great. Well, I'd love to get into this concept of transformational healthcare and that shift from transactional. What can you tell us? What does that shift look like? What is transactional healthcare and what is this new transformational approach?
Yeah, great question. And Matt, thanks for having me. It's an honor to join you today for this podcast and talk about this shift, if we can, from transactional healthcare delivery to transformational. It's important. So let's talk about the model we're in now, transactional, right? It's very episodic. I go to a doctor, I get a visit. I go to a doctor, I get a test. I go to, we're very reactive. We treat issues as they come up. It's very symptom focused, and the system is designed that way to focus on the symptoms, to get reimbursed for those, treatments, et cetera. If we shift to, and when we shift to this transformational healthcare delivery model, we're going to stand that on its head because we're really going to be focusing on outcomes. We're really going to be focusing on keeping people healthy, right? On the underlying causes of illness. We're going to be looking at what lifestyle can I, help this individual with to make them and keep them healthy. So it's really focused more on outcomes and on health than it is on episodes and illness.
Got it. So that member is really at the center, and the outcomes are really the goal versus, incident A leads to treatment B, so on and so forth.
It feels almost sad that we have to say it that way because the member should always be at the middle of our healthcare system, but the reality is it hasn't been that way. So you're right.
What are the factors that are driving that shift, Neal, in that model approach from transactional to transformational?
I'd say the biggest one is just unsustainability, economic unsustainability. I mean, as a consumer, we all as consumers, pay for health insurance, that those prices are going up. Employers pay for a lot of that coverage. Those are going up. Certainly at the federal level are things, going on that are impacting the cost of healthcare. And basically, it's not sustainable. We can't afford as a country to work by this transactional model. That may be the doomsayer side. The positive side is we have technology that is allowing us to shift our model. We now have AI, right? We are better at predicting healthcare events than we've ever been. We have real-time data and access, or at least access to real-time data. We have telehealth, right? So we've got these technologies that are pushing us, or at least trying to maybe pull us in that direction at the same time that we've got major headwinds from the economic pressures.
So access to that technology or leveraging that new technology and also, increase costs with probably, you could say, diminishing returns.
100%.
Terrific. You mentioned technology. One of the things we hear a lot about, especially during COVID, was virtual appointments, virtual assessments. How does that fit into this transformational model? Is it a net benefit for the patient for the model? Is there value in those virtual assessments?
Well, if we learn one thing during the pandemic, it's that there's a role for virtual care, right? And having read some reports recently, found that in many instances, the data that we collect from virtual, at least assessments and some, virtual visits can be just as efficacious as in person. That said, there's a time and a place for the right type of intervention. And in today's healthcare system, when you go to the doctor, when I go to the doctor, frequently they could be running an hour behind and then they rush us in and they have 5 minutes or 10 minutes and then they're moving on. Very transactional, right? In a virtual environment, well, first of all, even before that, I might not have to call and spend 10 minutes on hold waiting to talk to someone who's going to schedule my appointment. I can go onto a portal, I can get it scheduled, and then I get to time with that doctor. I may get 30 minutes with that doctor because it's just that administrative burdens are eased on the provider side as well in that environment. So I like to think that again, there's a role for virtual work, and we just have to fit it into the context of what's best for the member.
Great. What about from the provider perspective? You talked about kind of churning patients, every 5 to 10 minutes, trying to get through that. As we shift to more of this transformational model, what's the benefit for providers? Is there a benefit? What are they seeing on their side?
I think the benefit for providers of the new model are significant, right? We have come to a place in our healthcare model where we are burning out an entire generation of healthcare providers, right? The older generation are retiring at, I believe, a near record clip. They're getting out of healthcare. And we have less that are either able or willing to want to go to school for higher levels of degree, for higher degrees in healthcare, because it is such a business-focused model. It's such a transactional model. And so we're at risk of getting to a place where we don't have, right? And we are already really where we don't have enough providers to manage the need that we have. So providers can be a big winner and would be a big winner in this model just because of, the ease of it, the administrative burdens placed on them, and the ease of just being able to interact with the system, I think will make the careers a lot more manageable.
Got it. And I've heard you talk about it really gets the provider back to the core of what they're after, or their goal is really to treat the patient.
Do no harm.
Right? Yeah, do no harm. To begin with the end in mind instead of focusing on all of those administrative task items. It sounds like it kind of shifts the focus for the providers back to the outcome or back to the patient.
Correct. I mean, the value-based models that are in play now are terrific in that they focus on the outcome. They're rewarding our ability to keep patients healthy, but we're in the infancy of this, right? We're just getting this started, and yet we have the technology and the tools to, I believe, move at a faster clip.
And what about on the inverse side, on the member side? What are they seeing in this shift? How is the experience changing for them?
Yeah, look, members are the big winners, right? They get the gold star in this new model. In the transactional model, I'm just talking to the patient. I'm transacting with them. I give them, see what the symptoms are, treat it, move along. In a transformational model, I want to take data that's incorporated from both systems that I'm working with, as well as community, as well as individuals in their lives. And I want to be able to use all that data to inform the best treatment approach. Not what can I do to manage the illness you've come with, but how can I keep you healthy? So we're asking a different question and we're utilizing a broader set of data to inform the answer. I think that's an amazing outcome for the member and their community and their system and whoever is living with them, assisting them, helping them live a healthier life.
Yeah. I mean, ultimately, that's where we want to focus our efforts is on the patient, is on those outcomes. And if we can leverage those technology, those data sets to get a little bit more insight and to make better informed decisions, everybody wins.
Absolutely.
One of the tools that we talked about briefly was the Connect mobile app. How is that tool kind of leveraged to better engage with members?
Yeah, so the Telligen Connect tool, portal, right, an application, is a terrific asset for them to use to connect with a case manager, connect with, someone in terms of how they're doing, and also allow us to see real-time information from them, from their treating providers. So it allows for the connectivity between us and providers, us and the member, which again is just kind of the baseline for all of this transformational model. How can I get what I need as quickly as possible to inform a better outcome?
Yeah, so just more access to the care team, just one more touch point, almost maybe a little bit of an educational tool for members as well.
Who doesn't have a phone now and who doesn't use applications, right, to connect to all different kinds of interactions? So I think this is just a step in the direction of we want to empower the healthcare system that we're interacting with to share information with us as quickly and as efficiently as possible.
Got it. We've talked a lot about improving outcomes for patients, but in the world of government payers, some of our clients, healthcare organizations, are there impacts that they can see in some of the overall outcomes or cost impacts when there is that shift to transformational healthcare?
100%. I mean, let's define this a little bit. Most states now have Medicaid managed care, right? So they're working with health insurers that have a lot of these tools and are able to, provide real-time data or at least access information. Telligen, as a whole, we interact primarily with the fee-for-service population. So these are populations that are generally more sicker, they're right, more chronic illness. So our goal is to utilize a transformational model to inform the state, right? Inform the state Medicaid agency on what we're seeing. We did this not too long ago. We had a state that we work with where we were given a huge set of maternal health data. And state hadn't really, given much thought to what it was. It just said, we need you to pull these on every live birth, right? We need you to have this data. We went ahead and did some analysis on it and gave that data back to them, which then helped them make some decisions around strategies going forward in their maternal health program. It was fantastic. It really is one of those instances of you get more than what you ask for. And I think that's important in a transformational model is we're not just looking at things episodically. We're not just looking at things as let's just see what's in front of us, but we're trying to take a more holistic picture of what's going on. And that's what we did with this data.
Got it. So yeah, expanding that beyond the traditional data to see what trends you can identify and where there are opportunities to kind of move the needle. I could see that being very valuable to, really anyone who's managing that care, whether that's a state Medicaid agency, a federal government, an employer group, all of those, they want their members, their patients to be healthier. And when they're healthier, there's cost savings available.
Absolutely. Reduced ER visits, reduced higher levels of care. All the kind of traditional metrics that we want to look at when we're trying to slow the cost of healthcare inflation, right? So yeah, all the tools in a transformational model, the tools are more proactive and they're more real time.
I like that. Yeah, proactive and more real time. Okay. So let's talk about sustainable impact. What does that mean to healthcare management? How do you measure that? How does that relate to transformational healthcare?
Well, you want to help healthcare systems be able to manage costs. This is all primarily cost driven. So you want them to be able to manage costs more effectively, right? And the sustainability of that is how do I put data in front of you that then lessens the total cost of care. So our goal is to use a transformational model, use data, AI informed information, and just holistic approach to treatment to reduce that overall medical spend, which then makes that system more sustainable.
Okay. Well, we can't talk about leveraging data automation without kind of trying to address some of the skeptics. What would you say to those skeptics who worry about integration of automation, virtual visits, too much technology getting in the way of patient care?
What I would say, Matt, is that the skeptics they have a point. You've got scenarios where you have a doctor that's reading a screen instead of, making eye contact with, an individual. You have, right? We now have instances where chatbots are replacing human judgment, right? In the triage process. And these aren't simply just, sort of what ifs, these are happening. So, but on the other hand, what we're providing today is it really We call it personalized healthcare. Is it really personalized healthcare? We talked about earlier, you've got doctor's appointments where you get 5 minutes with that healthcare professional, right? You've got, disconnected, fragmented delivery systems where you've got an individual repeating their medical history 3 or 4 or 5 different times. So is there a role for technology and in this model? 100%. We just have to make sure that it's implemented correctly and that it enhances care, that it makes care more personal, and that it just is more focused on and it addresses outcomes, keeping somebody healthy versus just treating their illness.
Great answer. Well, and let's go maybe big picture here. When we talk about the impact of transformational changes across the healthcare system, if you were king for a day and could make a change to the healthcare delivery system, what would it be?
Here's what I would tell you, and we've talked about it during the course of this interview, which is administrative burden. Oh my God, do we spend it and waste a ton of money on administrative processes, right? They're virtually like bankrupting parts of our healthcare delivery system, or at least putting them into significant debt. So if I was king for a day of healthcare and could make one change that I thought could have a meaningful impact on the delivery system, I would eliminate as much of that administrative hassle as I could.
Got it. Just streamline it.
Just make it so that the patient-provider interaction is the most important thing, right? And they can focus on that individual in that system and really be focused on what's the best thing to keep this person healthy, not how do I get this visit over with so I can, bill for it and move on to the next one.
Yeah. Not to get caught up in all the administrative burden. That makes sense. Makes plenty of sense.
Look, there are other big ticket items. Drug costs are certainly through the roof, but look, that's the one that going back to my provider days, that even back when I was practicing was a big deal. Like the burden of filling out paperwork and sending it in and waiting for a response and, not having real-time information available to me, right? Or even getting close to real-time responses was always a challenge. It was a challenge for my relationship with the member because I had to tell them to wait. I'll get back to you. We'll try to figure this out. If I could do one thing to make the whole system easier, I'd eliminate as much of that as I could.
I like it. I like that approach. I think that's the right approach. And hopefully we're getting closer to that with this shift to transformational healthcare.
Indeed.
Well, this has been great, Neal. Really have enjoyed interacting with you, listening to you, hearing your perspective. Thank you for joining us. Appreciate all your insight.
Matt, thanks for having me. It's great to talk about this opportunity. And at Telligen, we're going to continue to be a leader. We're going to continue to use the analytics that we have and the tools that we have to work with partners and drive better outcomes.
Terrific. Yeah. Noble pursuit. Well, great. And thank you to everyone for listening. We hope you've enjoyed today's topic of the shift from transactional to transformational healthcare. This podcast was recorded at Trilect Studios with Cooper Maas Engineering. Producers for this episode are Chris English and Tammy Lichtenberg. If you have questions or would like to know more about Telligen, please visit our website at telligen.com. Thank you and see you again soon.